John Nicholas. I'm here with Charmaine Conahan. This is the second part of our discussion on home care and assisted living facilities and similar communities for senior citizens. Charmaine, maybe just give again an introduction on your background and your work as Executive Director and owner of Always Best Care.
Hi, John. Thank you so much for having me. I really enjoy these discussions. So I am the owner, as you said, and Executive Director of Always Best Care Senior Services. We cover Glenview and the North Shore and a few other suburbs. What we do is we send caregivers who are our employees out to folks who need assistance, and that is whether they are living in their own private homes, condos, senior buildings, and senior communities, including independent living, continuing care retirement communities, assisted living, and also memory care. And we can also help people one-on-one when they're in a long-term skilled facility as well. If they're rehabbing or if they live there long-term, we can help them one-on-one there too. And when it is not a pandemic, we can also help people in the hospital while they're staying in the hospital, especially folks with dementia. But right now, we're not allowed into the hospitals.
So Charmaine, what are some of the services that a person can get in their home?
So John, of course, you can have caregiving services in your home. That's what we provide. But the other types of services that you can have brought into your home are really more expansive now than they ever have been. You can have therapy services provided by Medicare, therapy provided by Medicare Part B, where you don't have to have come from an acute setting. You can actually have therapy brought in if you're getting weaker or if there is a specific need that you need addressed. So you can have therapy brought in. You can have visiting physicians brought in. If you have a visiting physician come in, you don't have to give up your primary care provider. You can have this additional service to make sure that your doctor can come to you. You can have if you're on blood thinners, you can have your blood levels checked without leaving your home. It's a wonderful thing. Other things that can be brought into the home, you can have x-rays in your home and an echocardiogram in your home even. If you're having trouble swallowing, I know of a company that we partner with that can bring in and do a swallow test for you in the privacy of your home. People are safer when they're home. And providing medical services and therapy services in the home, the government's finally realizing that it is less expensive to treat people at home than sending them to a hospital or to a nursing home. So there are many things that you can have brought to you that'll keep you safer.
Charmaine, what are some tips for people to how to select the right senior housing or assisted living community for their particular situation?
Well, that could be a complicated answer, but I'll try to simplify it. For one thing, when families are considering a move to a senior community, it is a little bit confusing for folks if they're doing it on their own, because you have several different levels of senior communities, and you really need to understand what those levels are and what your loved one would be appropriate for. One of the things that we can help people with is figuring out what their senior is appropriate for. We help people with what their budget would allow, and we also help them with factoring into that decision geographic location and just preferences.
And if someone's touring a facility, anything in particular they should keep an eye out for?
Well, it depends on where you're looking, but say you're looking at an assisted living facility, and if your loved one is showing some signs of memory loss, but not severe memory loss, what you could do is look at an assisted living building that has a memory care floor or neighborhood in it, or you can look at only memory care. And one of the things that you should look for is certainly staffing levels. If there seems to be enough certified nursing assistants and nurses and administrative staff in the building, you certainly, of course, want to look at cleanliness. How does it look? Are things looking threadbare, or does the community look well taken care of? You also want to, believe it or not, you also want to do your smell test. If it doesn't smell very nice in there, that is a good indicator that there are some things that are going wrong there. And I would say the number one problem, if there is an odor, is that there is not enough staffing, because people are not being kept clean and they're not being attended to frequently enough. But some of the things that you need to be aware of if you're touring communities is how are they handling group activities? How are they managing with the problem of isolation? There are many things that we have to consider when we're touring a community, and now with us in a pandemic, it just complicates everything.
How do you balance the increasing service that you can get in your actual own home now, as opposed to some of the benefits, mental benefits of being in a community type facility?
So there are differences between, living in your own home and battling isolation and touring communities. When you are considering a living or moving to a community, you need to consider right now during the pandemic, you need to consider whether or not family can visit, right? If a family is looking at an independent living community or a continuing care retirement community, and what that is it's a campus where everything is all in one place. It's independent living, assisted living, skilled care, and memory care. So people are either looking at standalone assisted livings, continuing care retirement communities, or standalone independent living communities and standalone memory care. So there's an array of places that people can consider. The visiting restrictions are pretty significant in most of these communities. The one type of community that the visiting is a little looser is independent living. So if you're in a standalone independent living community or in a continuing care retirement community in the independent living section, family is allowed to visit right now and has been. So there is the danger of people really being isolated when they're living in their home. Also, some people, if they're in their home, sometimes if they have dementia and their dementia may not be really very well managed at home. Even with a caregiver, it can get very complicated in extreme cases, and they really just need to be safe and be in memory care. So there's a lot of factors, and that's why talking to someone who can help you navigate this is a good idea.
And again, you talk a little bit about the financial considerations.
Home care is not inexpensive, and we talked about this when the last time we had a discussion. Home care live-in care can be about between $2,300 and $2,500 a week. So that is a significant amount of money that people need to understand. Assisted living can be about between $6,000 and $10,000 a month. $10,000 being on the high side, but it starts at about $6,000 a month for assisted living. So assisted living is less expensive in some ways than home care, but the big difference is, and this can be okay for some people, but the difference is you don't have one-on-one care when you're in a community. When you have home care, you have one person taking care of you. When you are in assisted living, you are one of many residents who have just a limited number of staff on the floor. So sometimes we do provide care in assisted living facilities because people, even though they are in assisted living, they are paying for that, they still need one-on-one care and they need us. They're a fall risk, or if they have dementia and they don't know they're a fall risk, and so they try to stand up and then they get hurt. So there's a lot of reasons why we have to be brought in. So it can be expensive. Long-term care insurance is really a helpful tool for folks. I wish more people had it.
Well, Charmaine, thank you very much. It's been very useful, very helpful information. Charmaine's contact information is at the end of this video. So again, thanks for being here and talking with us.
Thanks, John. It was really fun. Thank you.